My final guest is a doctor and a congressman who says we need to build on the success of Operation Warp Speed. That came up earlier today in our program. Welcome, Congressman Brad Wenstrup, good friend of mine, Republican from Ohio. I don't do a health topic without going to him, see if I knock on his door and see if he'll come in. But Congressman Wenstrup, thank you for joining us. We did have, Wes Wheeler, the president of UPS Healthcare, also talk about General Perna, Operation Warp Speed, the infrastructure that got set up. And he said that was really vital to UPS getting in there in a program where we talked to CVS Caremark as well and their chief medical officer. And there is this debate right now about, okay, what was in place, what wasn't in place. Some say nothing was in place, but, Wes mentioned this. So I know that you are a fan of Operation Warp Speed. You think we need to build on that, not run away from it. But tell us, as we look at this in this, anchor moment, what are the blind spots we have in this conversation that we need to get over?
Well, thanks. First of all, thanks for having me on, Steve. I appreciate it. You look like you're hanging in there pretty well because I know you've been going at this for a while today. So I give you credit. So stay healthy. We need you out there to help share these types of messages from all different angles. And, let me just talk for a second about Operation Warp Speed and get into your question there. I can tell you as a physician, it's really pretty amazing and marvelous that we are at this point, that we were able to get a vaccine or two, as the case may be, maybe soon to be four, within a year's time. It's really pretty impressive. The soonest we've ever gotten one done before is 4 years. And I think all those that are involved in the medical community and especially involved with this process that took place, we see that we have the capabilities and the wherewithal sometimes in this country to do amazing things and do them fast. Are there going to be glitches? Sure there are. But think about what took place. This was a whole of America type of event. You talk about all the way to UPS and everything else. The volunteers that got in these trials, the tens of thousands that volunteered so that we could come up with something that could be a preventive for people. And, through this whole process, something that you've touched on is trust. So where's one of the holes that we need to plug? And it probably is trust. I think that's a big one. I always, when I first ran for Congress, I've been in the military since 1998, did a year in Iraq, and I always said, when I'm out and about and I'm in my uniform, I can tell people trust me. When I'm playing the doctor and I'm in my white coat and taking care of patients, I can tell they trust me. You put the congressional pin on and all bets are off. And I'm sure you can appreciate that. The trust factor is a grave concern to me because, I sit on Intelligence Committee. There's nothing that our adversaries like more is when we are divided on something. And especially if we're divided on something that has a huge effect on our health. So I know you've had a long day of talking about how we got where we are and where we need to go from there. I said Operation Warp Speed. I think we're carrying out what Operation Warp Speed said to do. I think President Biden is doing that. The numbers match up with what some of the plans are. Distribution's tough. I'm glad that they brought in the military. As a military person who's gone to war, I can tell you I don't know any other group, Steve, that does better at logistics on a major scale than our military. If you think about it, this is the group of people that know how to get things wherever we want them, whenever we want them, anywhere in the world. That doesn't mean it's always smooth sailing. It's tough. And so now we get down to the local level. And I think about, I served on our Board of Health in Cincinnati, Ohio, and we didn't have anything like this. But you understand the challenges that it takes to get to people. And I think some of your previous guests, have kind of hit on some of that. And so distribution, how can we do better? Well, this summer, I'm in the Army Reserve, but I spent time with our Ohio National Guard, and I went out and did drive-up testing. So, we learned a lot about that. And I think Ohio plans to do the same thing with National Guard. And we went to the communities that are least served. That's where we tried to go. So it was most convenient where people could walk up or drive up to get tested. And we need to do the same thing with this vaccine. Every state was told to try to have in place by November 1st their distribution plan. That was the challenge coming from the federal government down to the states. Some have done it better than others, I'd say. And sometimes we don't know exactly how many we're going to get and when we're going to get them. And that's a challenge for anyone in leadership when it comes to distribution. You know, we have federally qualified health centers, usually in areas where they're underserved. I represent both urban, where we have that type of area, and I also represent rural, where the challenges are somewhat similar, just slightly different because of the population, distance, and ability for people to travel to get to sites. So we have to engage with that as well. And I think that what we have learned about the virus since the beginning, you know, has been tremendous. It's called novel for a reason, I'd say, that nothing else really has matched this. I think that physicians and researchers were right when they said, well, we expect, like other flus, this will go away in the summer. Well, guess what? It didn't.
Right.
You know, so you have to adapt and overcome. You have to face these things as you realize them. And I think that's one of the challenges now, but we certainly have a pretty good beat on who is most vulnerable and trying to get to those. Sometimes it's vulnerable because of a community, socioeconomic status. Other times it's because of underlying conditions and age. And so you have to look at all of those and try and hit as many as you can, as fast as you can. You know, it's like when there's a storm and the power goes out, the power company goes and hits the places and fixes the places first that they can get most people back online. If your power's out from the street to your house, you're probably last. So you have to sit and make priorities like this, and they're tough calls because you only have so much wherewithal. Sometimes it's a personnel problem. Sometimes it's actually having the vaccine.
Right.
We've learned a lot about supply chain problems that we have in our country through this event, through COVID, when we didn't have personal protective equipment, and you realize that we depend on our adversary for it. So a lot of leadership challenges and a lot of challenges ahead, but we got to keep listening to the communities like you're doing today and set our priorities, and better at the local level as long as we get what the local level needs.
Brad, thank you for that. That's a really comprehensive. You answered 3 of the questions I was going to ask, so that's terrific. But I want to, you know, when I've talked to you before, you were pretty critical early on of some elements of shutdowns, particularly in the healthcare area, of going for like elective surgeries, elective health, you know, health care. And that created a kind of depression, if you will, in the economic impact to doctors that serve, particularly in rural areas that are out there. I guess where we are now, is that infrastructure wiped out? Is it there? Is it wobbly? I mean, I'd just love to get it, because I know you're in the doctor's caucus there. I don't know the answer to that, because I do know that in terms of what you say, that the most trusted person in healthcare is a person's, you know, personal doctor. But how are they? Are they out there, or are they wiped out?
Well, they certainly struggled. Practices struggled. Some ended up, you know, leaving in the rural areas and joining large healthcare systems, or moving more towards the urban setting or closer to it, and becoming part of a hospital system. So there were changes like that. The desire is out there. As I go through my community, I think they've done pretty well. My rural hospitals have set up plans, and I'll give you an example. So one of my rural hospitals, you go through the first couple of months of this, and they had no cases, yet they were shut down. So economically, they were really struggling because they weren't even seeing COVID patients. Then when they started seeing COVID patients months into this, and they worried about their skilled nursing facilities and nursing homes and this and that, what they did is they sent a nurse practitioner to round on the patients every day. That came from the hospital themselves. They took that on, because they don't have as large numbers in that rural community. But finding new ways to try and be on top of things has been helpful. Everyone is eager to distribute and to administer the vaccine to as many people as possible. And as the numbers grow, you know, manufacturing is a problem. Manufacturing, we saw, was a problem just for masks for us. But I will say we were more prepared than we've ever been with manufacturing, considering that when you get to phase 3, 100 million doses were automatically made. The risk was you throw it away if you're not approved, and the benefit is you have a start. So everything was trying to be in advance of the next phase. It doesn't mean it wasn't without challenges, but we've done better than ever before. And through this experience, I think we'll do even better in the future. You touched on one thing that's important for all of us to remember, and I think some of your guests have alluded to this today, that when we had the nation really just focusing on the virus and having to, for supply reasons, et cetera, say we've got to shut down everything, and also because of a lot of unknowns, we shut down a lot of other healthcare. It led to a lot of unintended consequences, and we always have to be looking at the health of the entire nation, not just focus on one thing. The pandemic is obviously one of the highest priorities, but you can't let the other things go, and we need to be prepared to never let that happen again.
Thank you. But just finally, as the administration has come in, and I've been on these daily calls listening to Jeff Zients and others, in this rollout of this. My sense is that on both sides of the aisle, there's sort of not too much controversy about this yet. I mean, so are you folks, do you see a bipartisan consensus that's sort of largely supportive of what the Biden team is doing, or is there a lot of skepticism on your side of the aisle?
Yeah, there's nothing I've seen being from the other side of the aisle that they're saying that is way off course. I do take a little debate on whether saying that they left them with nothing and bliss. Right. That to me is not true. And I think Dr. Fauci has refuted that as well. And he may have done that today when he was on. But a lot was done. And let's build on that. So if you're saying we're going to administer the same number of doses that Operation Warp Speed said they wanted to do, that's great. But we really want to challenge ourselves. Let's do even more and find ways to do that, because the sooner we get to everybody, the better. And if I can touch on one other thing, too, that Sure. from your previous guest, it's been important in my community to go to the areas that usually feel like they're left out or where there is greatest distrust. And, in our area, we've engaged with the leadership of African-American physicians to be out there and, lead the testing and lead the vaccinations as well, to develop that trust that understandably some people don't have. But I always found in my practice, which we had a very multicultural practice, that you have the one-on-one relationship and there's trust there.
I'm going to sneak one more in. The COVID relief bill, this next version, is there something in it that you don't want in it? Is there something that you think should be in it that's not in it?
Well, I haven't gone through it with as great a detail as I'd like. I want it to be focused on COVID yes. and COVID relief specifically, and for getting people better and their communities back to healthy, not just medically healthy, but economically healthy, and focused on COVID-related problems that have existed or have occurred.
Well, Brad Wenstrup, Congressman from Ohio, we've done a lot of stuff internationally. I always learn from you, and I really appreciate you accepting our call to come on and talk about these important issues, and we'll call on you again, I hope. So thank you so much for joining us today.
Anytime, Steve. Thank you.